Hello guys, welcome back to the Gatekeepers TV, the health talk segment. Today we are with our drug specialist, and today we want to talk about a specific drug called methamphetamine. He will actually take us through what that drug is, what it does, what are its effects in the society, and currently why is the government so much following up its development, especially in the coastal region. After this segment, you'll have learned a lot about methamphetamine and the do's and the don'ts when it comes to this important medication, which is available in your pharmacies, but because of its effects, it's a potential drug of abuse in the community. So, welcome to the show. Robert, talk to us.
Yes, hello guys, I'm Robert, your drug specialist. Thank you very much, Dennis. Yes, today we want to talk about methamphetamine. What do you know about methamphetamine? So there's a recent news. There was a seizure of methamphetamine along our coastal border worth 8.2 billion shillings. Wow, that's much, 8.2 billion shillings. So what do you know about methamphetamine? Yes, methamphetamine is a psychostimulant medicine. Actually, it's a synthetic medicine that is manufactured from pseudoephedrine. So how does it normally work? So methamphetamine works by stimulating the release of dopamine in the brain. Then it works also by inhibiting the reuptake of dopamine in the brain. So you know very well that dopamine is a neurotransmitter that works under a reward system, that if you do something good, you have to be rewarded. So that's why most of the guys are using methamphetamine. So how can you get methamphetamine, and what are the forms that it's available? Actually, it's called white crystal or meth. That's the street name. So you can get methamphetamine in form of powders, where it's being snorted. You can get methamphetamine in form of tablets. You can get methamphetamine in form of injectable, where it's being injected. So what is the most forms is being abused is form of powder, where most guys snort methamphetamine. So what are the uses of methamphetamine? Number one, methamphetamine is used to treat narcolepsy. Narcolepsy is a disorder where you get difficulty you have a sleep disorder. That is, you find sometimes, most of the time, you get sleepy. Number two, it's used to treat ADHD. That is attention deficit hyperactive disorder. Then number three, it's used to manage weight. Please don't take this one as Ozempic, no? But it's used to manage weight under strict supervision from your medical health provider. So those are the cardinal uses of methamphetamine. Actually, so methamphetamine, and we have some called amphetamine. So methamphetamine is the one is highly being abused, but amphetamine mostly used in the medication roles in managing one of the diseases I've highlighted about. So why should you not use methamphetamine? These are the potential consequences and the side effects severe. Number one, methamphetamine can lead to psychosis. Also, it can lead to anxiety, and also methamphetamine, it can lead to somebody having aggressive disorders. So we are highly encouraging people not to use methamphetamine, because this substance also is very addictive and dependent. So most of the cases you find that, where does this medicine get abused so much? So there is a thing we call PWO, that is people who use opioids. So people use opioids normally have some side effects like sedative action. So guys who normally use methamphetamine, they abuse methamphetamine just to counteract the effect of sedative action of opioids. Opioids are medicine like codeine, like morphine, or yeah. So those are the things that can lead somebody to use methamphetamine so much. So yeah, what are the consequences of using methamphetamine in the society? Number one, it leads to high incidence of crime rate, because you find that youths who use methamphetamine, sometimes they run out of cash because it's highly also expensive drug. So the only way they can get cash to purchase that particular drug is to involve in a criminal act. And also it's very expensive in the economy of the government, since these medicines, like the one that was recently seized in the along our coastal borderline, it was tracked from the point where it's being synthesized to the environment where it's being trafficked. So it means the government is using a lot of resources to do all these things. So it's very expensive to our economy. So our parting shot is that, yes, methamphetamine is highly abused in Kenya, mostly in the coastal region, as there was a recent report by NACADA. And in the world, the most places that is being abused is Philippines, that is followed by United States of America. So methamphetamine has severe health side effects, so please stay away from drug abuse, that is methamphetamine. Stay healthy,
Guys,
keep it locked.
You just heard it from our drug specialist. We've just discussed a lot about methamphetamine. I hope that you've stayed tuned, you've been educated, you've been informed, and above everything, you are going to help us as we also help this country to publicize the news about amphetamine, and more so to help our youths to keep safe from abusing this very medication or this very drug. Otherwise, guys, continue keeping it the Gatekeepers TV. We will always be bringing to you these segments whereby each and every week you will be learning something new about a different molecule or a different drug in the medical world. Otherwise, thank you so much, Robert, for gracing our show and for actually educating us. It was nice having you on set. Until next time, thank you so much.